Third year was really a year of new everything, like new revision method, new location of teaching, meeting new people, just new.
This is so cringe. I really felt part of the team.
Don't start crying now. If you want me to be honest, I didn't think our friendship was going to survive it. Can I actually do this? Am I actually good enough?
Your mind can change. Like, what you want from life can change. What you want from your education can change. This is the first year I've been like, do I actually want to be a doctor?
Hi everyone, my name is Liddy.
And my name is Hazal.
We are both two UK-based medical students, and we use this channel to document our journey to becoming doctors while also sharing student tips along the way.
I know we usually say we're third year medical students, but your girls just finished their exam, so we're basically fourth year medics.
Technically, talking about finishing third year, we have so much to talk about, from imposter syndrome to regrets to hospital placements across the UK and more.
This video will be split up into 5 different sections, and the questions we'll be talking about, as well as the timestamps, can be found down below.
Okay, so first off, let's get started with the transition.
Question 1. What is the difference between the clinical years and preclinical years of medical school? So obviously the first 2 years of medical school are the preclinical years, and these years consist of mainly lectures where we learn about the human body, the anatomy, the physiology, the histology, and basically the science behind all the different diseases we need to know about. During this term, we spend most of our time on campus and we don't really get much clinical experience. However, this is very different to our clinical years, where we spend basically most of our time on hospital wards.
And this is mainly because at this point we need to essentially learn all of the information that we need for exams directly from patients. We're actually practicing how to be doctors, practically interacting with patients, looking into their conditions, their treatment options, etc. So the teaching methods are very different, as well as the information that we need to consume. Preclinicals is essentially heavily theory based and textbook based, whereas third year and above, the clinical years, is more about the clinical aspects of things and actually treating real patients. So what were your expectations going into clinical years? Should I start this one off?
Yeah, go on.
Before entering third year, I think we heard from a lot of the older years that, you know, third year was super easy. It was going to be such an easy year to pass, and how third year is, you know, the treat you get for surviving first and second year. So I did think that it was going to be more manageable. I also was a bit nervous about it as well, and I did think as well that I would have to step out of my comfort zone and be a bit uncomfortable, just because I'm going to have to be on the wards acting like I know what I'm doing, and half of the time I am bloody confused with what's going on. So yeah, those are 2 things I was expecting from third year: imposter syndrome, and for it to be a bit more manageable.
I would say I was really excited for third year because we had just finished second year, and basically all of that was online because of COVID. So I was excited to get some sort of in-person learning, whether it's lectures or hospitals. And also, as a medical student, you think you're going to be on hospital wards from day one, and obviously it's not. So when we were finally able to go on hospital wards and talk to patients and do some of the things that we will be expected to do as doctors, it was a bit exciting. Like, it was a bit like, oh, I'm a bit of a medical student now.
Follow-up question: would you say it then lived up to your expectations? I think in terms of imposter syndrome, it 100% did. Guys, I felt imposter syndrome like I've never before on those hospital wards, because I think some doctors just expect so much from you and expect you to know so much. But number one, my curriculum is very different to your curriculum when you was back at medical school. Number 2, I'm only starting clinical years, so I don't know what is going on half of the time, and I think some doctors didn't understand that and didn't help with imposter syndrome, making you feel out of place. Putting that to the side, not even interacting with doctors, I think third year really makes you feel like, am I actually good enough to be a doctor? Because you're finally doing practical things, and you can finally see yourself being a doctor and speaking to patients and taking blood from patients, all of these things. And you know, it does make you deep. I'm going to be finishing medical school soon, and this is actually going to be my life. Like, can I actually do this? Am I actually good enough? So yeah, it definitely made me feel imposter syndrome 100%.
I would say I actually really enjoyed third year. Obviously, exam season was a bit rough, which we'll touch on later. This is going to be so moist. I felt so cool. Like, on hospital wards, like, after you pass that imposter syndrome, after you pass getting to know the people on the wards, I really enjoyed going in the morning, saying hi to all the doctors, going on the ward round, and then grabbing a coffee later. Like, I really felt part of the team. This is so cringe. I really felt part of the team.
Don't start crying now.
And I really felt like I fit in. Even though at the start it's quite hard because you genuinely don't know what you're doing. But once you figure it out, it does get a lot better. It was a really good year to experience. Like, it was so much better than first and second year in terms of the clinical experience, which makes sense. What did third year of medical school consist of? So we've basically kind of touched on this already, but essentially it's about finding your feet in the hospital, understanding what clinical placements are like, and being able to take a good history and an examination from a patient, understanding their signs and symptoms, and having a brief understanding of what their management and treatment could look like.
On top of that as well, apart from like taking a history and examining, doing physical examinations of patients, also being able to like take bloods. There are different procedures we had to learn how to do, like catheters. I'll put an image of it online so that you guys can see how like invasive that one is. Venipuncture, which is essentially just taking bloods from a patient. Cannulas, just various different procedures we had to learn how to do. So they really threw us into the deep end. That's what it consists of essentially. How would you say the jump felt like going from pre-clinical years where we were basically like, you know, babied and had to do textbook stuff to being thrown into the deep end in clinical years? How was that jump for you?
I think it was a big jump, but it was a jump I needed. I think if I had another year of lectures, like medicine was just going to get really boring. You know when you're really excited to jump into the deep end of a pool because you can swim? It was like I jumped in and I couldn't really swim, but like I wasn't drowning either. That's like the best way to explain it.
I think I found the jump so difficult at first, so difficult. Like, I think if you guys watched the first week of med school vlog I did, I was drowning in work, I was struggling, I couldn't map out how I was going to survive this year. And obviously fear of the unknown. I didn't know what to expect from hospital placement. You can watch as many videos as you want and speak to as many older years as you want, but you don't really know what it's like until you do it. So I was so scared, but eventually guys, like eventually as in a few months ago, things did turn out okay. But I'm someone, I don't really like change, so it was very uncomfortable for me and very difficult for me at the beginning of the year to kind of get used to clinical years and this new method of teaching.
It definitely wasn't easy, but I think we figured it out somewhat.
So the next section we're going to be discussing is all things hospital placement.
So what was your best experience on hospital placement?
You go first.
Should I go first?
You always do this, but I literally know it's at the top of your head.
I don't know, wait. Okay. I have two best experiences.
Because we said the best, like you've got a singular.
Basically, it was when we did a night shift.
I was going to take that one.
Well, I took it. Find a new one.
we have the same one,
okay,
so you can answer for both of us.
Okay, fine. Basically, when we did a night shift, you guys might think, why did you do that?
A night shift meaning placement is 9 to 5 p.m, but we voluntarily chose out of our own will to come back to the hospital at 7 p.m.
8 p.m.
At 8 p.m. and not leave until 7 a.m. in the next morning out of choice.
We weren't forced.
We weren't forced. We weren't going to get any extra points from this. We did it just for fun.
Yeah. Wait, no. Liddy volunteered. Okay, no, guys, we need to discuss this because it's actually not fair. Liddy volunteered, was like, met a really nice doctor. The doctor was like, come do a night shift. Liddy was like, okay. So Liddy volunteered, and because it was like 8 p.m, I was like, okay, I'll drop her to the hospital, right? So I'm like, la-di-da-di-da, driving her to the hospital. And then she was like, Azal, why don't you come with me? And I don't know what took over me. I must have been really tired or something.
She came with me. We changed it to scrubs and we had the best night ever. It was like the best doctor I've ever met on placement.
Yeah.
I couldn't let the opportunity.
Best doctors, like they were really nice.
They were so lovely. Yeah. It was the colorectal surgical team in like our last placement. They were so lovely and just learnt so much. And one of the surgeons brought us food at like 2 a.m.
We got like big
and we
chicken
were all in
wraps.
the staff room just eating chicken wraps and talking. It was just so lit.
Yeah, and then we all had took a nap in the staff room.
Yeah.
It was just such a fun experience.
And we witnessed, what surgery was it that we saw?
Appendectomy.
Appendicectomy. Something like that. Yeah. And then we went A&E and
oh my gosh, and A&E there were 100 patients.
A&E, there was so much happening. There was a doctor leaving medicine to go start a 6-figure business. There was another healthcare professional crying. It was a lot, but it was so fun. It was thrilling.
And I think because there wasn't the normal hustle bustle of daytime hospital life, the doctors were able to give us a lot more teaching and a lot more experience, hands-on experience. Yeah. So yeah,
it felt refreshing.
Obviously, I was tired in the morning, but and I probably wouldn't do it again because I'm not getting paid.
Unless I'm getting paid.
Yeah.
when
I will be. Yeah. But yeah, it was a really good experience.
Yeah.
And finally, for this section, what do you want to specialize in?
Meaning, what type of doctor do you want to be? You go first.
Okay, there's a couple specialities I like.
Narrow it down. Answer the question.
Why can I never pick one answer? Okay, either GP or breast. maybe. And breast meaning like dealing with breast cancers, breast lumps, surgery, other pathologies that come with it as well. I like the speciality simply because of the team.
I think for me, obviously 100% GP, because I think I don't know if I verbalized this before, but I definitely see myself having a portfolio career, which is when you're doing a bit of everything. Like you're not just stuck into one profession. So I definitely see that for myself, but obviously you can never be sure. But if I do a portfolio career, I'll probably go down a GP route, just because you know you are still a doctor, you are still doing enjoyable things and treating patients, but you tend to have a better work-life balance. If not, I'm also liking gastroenterology. I don't know if it's because the university keeps placing me on gastroenterology throughout the year, so I've literally memorized all the facts. But yeah, I've actually enjoyed it because, you know, it's conditions that I'm familiar with, and you know, it hasn't been difficult to get around on the wards. But I don't know, I don't see myself doing that, but maybe
it's just like a maybe. The next section is studying, which actually has only one question, and that is, what was your study method for third year?
So at the beginning of the year, and you guys can probably map all of my actions with the vlogs, with the vlogs we release. I was literally just like passively making notes, as I'm used to doing in first and second year, and I actually made a video on why I will no longer be taking notes at medical school that you should definitely check out after this. But yeah, it was just passive, and it's just not what you need to pass clinical years of medical school. Passive note taking is the last thing you need. So that's what I was doing at the beginning of the year, and then later on, after speaking to a few other students and kind of seeing what third year is all about, I understood the assignment, and what I started doing was essentially just using PassMed, like PassMed clinical questions, just going through the entire thing. Whenever I was stuck on a topic, using national guidelines like BNF and NICE, or useful websites like Geeky Medics and Zero to Final to really understand all the gaps in my knowledge, and also referring back to my lectures if needed as well. But the main thing with third year is do clinical questions. You can use QuesMed, you can use PassMed, whatever. Use whatever you need to use, ensuring that you're actually learning national guidelines. Like, don't just listen to lecture content that could be outdated. What are the UK national guidelines that doctors are following in 2022? So yeah, that was the main thing for me towards the end of the year. So the next section is new experiences. Guys, third year was really a year of new everything, like new revision method, new location of teaching, meeting new people, just new. The first question is, how was your experience of living out? For those of you who don't know, for the past 2 years at medical school, I've been commuting at home, so it was like the first time being away from home. And what about you?
I lived out for first year of medical school, and that got cut short because of COVID anyway, and then second year I was at home, and then for third year we both were able to move out for 2 of our hospital placements. So at Barts you can get placed in a hospital inside of London, which is called an infirm, or outside of London, which is an outfirm, and we got 1 infirm and 2 outfirms. And if you get an outfirm, you get provided with accommodation closer to the hospital because obviously it's further to travel to. So yeah, we got 2 outfirms and we were able to live out. How was it?
I think at first it was really scary. Like, I am such a family oriented person. I love being around my family. Like, I've got 6 siblings at home. I'm used to the noise, I'm used to people. So when I first moved out, it was a bit difficult. I was like, oh my gosh, it's so quiet. I only live with 2 other people. It wasn't it. But I think over time I got used to independence, and obviously me and Hazal, our social life is set up in London. Like, all our friends are in London. All the activities we do are in London. So we would go back to London every 2 weeks anyways. So I never really got the opportunity to be homesick. And I met lovely people, lovely flatmates and everything. I think we really got lucky with that. We made really nice friendships from it. And on top of that, Hazal was always nearby, so it was whenever I was like missing home or missing familiarity, she was always there, which was really nice as well.
And this was also our first time like living together. We basically kind of live together anyway, like we do everything together, but this was a new level added to everything we do together anyway.
If you want me to be honest, I didn't think our friendship was going to survive it. I didn't think so, because you know what it is, we're together 24/7, and obviously sometimes it does get a bit annoying and we need our space.
She's so annoying.
I'm not. So I was like, living together on top of YouTube together and medical school together, we're gonna crack.
I actually think it made us like closer friends
Stronger.
somehow. But yeah, it just worked out. Like, I don't even know how to explain it. It just worked out. Like, you can see from our vlogs from our last placement, I just feel like it made sense. We started gym together,
which was really nice. We started taking our fitness journey seriously. I hope you guys are proud of us.
I just think we cooked together, we like ate together, but then we also both understood when to give each other space if we needed
and respect that as well.
Like, we revised together if we wanted to, didn't revise together if we didn't want to.
We had our own individual friendships and individual things to do. We weren't like stuck at the hips like
Yeah.
24/7, maybe 23/6, but not 24/7, which I think was refreshing.
I think it works, and if we were to live out together again, like, I think it'll be good.
Yeah, I think I wouldn't want to live out with just me and you though. I still do think
No, it's nice
like,
to have other people.
Like a little buffer. Do you understand what I mean? Like a
Yeah.
buffer of other humans that aren't as out.
I liked going into the kitchen and seeing who I was going to bump into.
Yeah, and just, you know, catching up with the rest of the flatmates was super chill. So yeah, overall, good experience.
Okay, guys, let's zone in, because this is a deep question. Has this year changed your opinion on medicine?
Of medicine.
Of medicine.
Yes.
Yes. You guys might be wondering, why did it change your opinion, all of this stuff, and I'm going to actually be 100% honest with you guys.
Oh my God.
I don't think I've said this online yet. This is an exclusive. This is the first year I've been like, do I actually want to be a doctor? And you guys might think, oh my gosh, you got to go into placement and you saw what you were going to do. Didn't that make you even more excited? And it did. Sometimes. But when you see the true reality, it's like, oh, like this is actually what I'm going to be doing. And then that makes you think, is this genuinely what I want?
Yeah, it was like a deep reality check, because the exciting stuff is really cool, the cardiac team running around and all that stuff is all lit, but there's also negatives of medicine, like the antisocial hours, the stress, the difficulty, the workload, the responsibility. Like, you saw it firsthand. You didn't just hear it and talk about it in a med school interview. You saw it firsthand and even experienced a glimpse of it, and it was like, oh, that's scary.
There were times when, like, maybe I slept late after revising, and then I had to get up early for placement, and then I'll be on the wards at 8 a.m. and there's just so much going on, and I'll look around and I'll be like, is this what I want to do? Like, is this where I want to be? And I did come to the conclusion that yes, I do want to do that, but it did take some deep thinking, because I think especially after you get into medicine, you never really question it. You're like, I'm in now, let's just ride the train. Yeah.
You never sit down and go, do I actually want to be a doctor?
And it's important to realise, like, you apply to medicine when you're 18 and now we're 21, going to become 22. Your mind can change. Like, what you want from life can change. What you want from your education can change.
As long as spitting bars.
So it was important for me to sit down and not just ignore that thought, but actually have a deep thought and think, genuinely, do you want this? Because it's not too late. It's never too late to change your mind, but you don't want to continue if you think it's not going to be the right path for you. But it is. I'm still here, still doing medicine.
Came to the conclusion it's fine. Yeah, I definitely agree. Like, I think third year, many people had these fluctuations. Like, I can't even count how many conversations I had with people, and they were just like, you know what, I'm probably not going to practice medicine after this. And it's like, you know what, fair enough. I see where you're coming from. Like, I've witnessed what you've witnessed. And I just think it's just one of those things, isn't it? But I think after the fluctuations of the, I love medicine, I hate medicine, I love medicine, I hate medicine, back to this, like,
we're currently on.
I'm happy doing it. I think I never got to I hate, I just got to, damn, is this really what I want to do?
And this is not to scare you guys. Like, I just think no matter what you're going into, you want to know the positives and the negatives. Exactly. It wouldn't be fair for me to go into a profession and not know any of the negatives, because I'm going to be hit with a hard reality. So we've made our informed decision. And finally, the last section is the overview. Let's start off with our third year ratings. Firstly, what would you rate your social life in third year out of 5? 3, 2, 1.
Wait. I need time to think.
Your social life.
Compared to other years?
Yeah.
Okay.
3, 2, 1.
4 out of 5. Why is yours 4?
Because I think this is the year I've been the most social, met the most people, had the most fun, like, outside of medicine. I went to Dubai in December. I went to Spain in September.
I went to Greece last month.
Literally.
Yeah, no, I agree. Like, it was definitely the year we've been the most social. We've met the most people, networking, having fun, like, living our best lives alongside medicine, taking our fitness seriously, just doing stuff, you know, just being social butterflies.
Okay, what would you rate hospital placement out of 5? 3, 2, 1, 3. Stop copying
We're
me.
literally twins. We're literally twins.
Why is it a 3?
Because I think...
What happened?
You're making me laugh. You know how we had 3 placement allocations this year? The first allocation, thou shall not be named. It was low-key shambolic. Like, it was low-key shambles. I really liked the fact that we only had to go in twice a week, because that was so convenient for my social life and my personal activities. But I do think, like, the organisation behind it, everything associated with that placement, it really gave me the ick. Like,
wait, guys, don't go back in our vlogs and find it.
Don't go back and find it, but it actually gave me the ick for hospital placement. I just didn't like it.
And then the other 2 kind of made it up.
I mean, the other 2 made up for it. Yeah, I think if I was in the place I was for my last placement for the whole year, it would go back up to a 4.
Yeah.
But I'm gonna say 3. I'm not gonna give it any higher, because at the end of the day, guys, I'm not being funny. Placement was bloody, like, Monday to Friday. maybe we get Wednesdays off for like extracurricular activities, you're expected to be there from like 9 to 3 maybe, and you leave placement and you're bloody tired, but you know, you've got to edit a YouTube video and you've got to revise for exams, and it was low-key a lot, so but it was fun. But 3.
And I think something that we haven't touched on is hospital placement has so much waiting around. Like, all the medical students say this, you see exciting stuff, but before that there's 2 hours of waiting, and after that
you're standing there, you're static, and you're waiting to just get the opportunity to do something.
Because especially at the start, you can't do anything alone. It always has to be observed. Doctors haven't got much time to observe me, so if I go to them like, hi, please, can you help me take some bloods, they're gonna be like, I'm busy. So a lot of waiting around just to see if something exciting is gonna happen, and then it doesn't happen and you can go home. But sometimes you catch on to the good stuff. Okay, what would you rate studying and revision out of 5?
3, 2, 1,
4. Did we literally have the same year experience?
Yeah, we did. Do you know what it is though?
4.
Because if you guys go watch my first year, second year review, one thing that really like pissed me off about medicine was in preclinicals was that there were never a lot of resources available for preclinical years. The best way to revise for preclinicals was the lecture material, but sometimes the lecture material wasn't clear, and to actually learn from lecture material you then have to go make your own flashcards and do this and that, and there were just so many steps to acquire the information I needed for my exams. Why am I begging you to give me the information I need to revise to pass my exams? Whereas with clinical years there are so many resources, like the answer I need is on Google. Do you understand what I mean? It was so easy to revise, and that made revision easier. The aspects where revision wasn't easy was completely on me. Like, I don't think it was medical school's fault. It was completely on me. Apart from like not having a lot of time due to placement, you know, I was a bit silly at the beginning of the year. Perhaps I could have organised my time a bit better, but overall I was able to revise better because there were better resources for preclinical years.
Well, I rated it a 1 because of my own choices. I couldn't figure out how to study, and then I couldn't find motivation to study, and then I didn't want to study,
and then you was making TikToks about not studying.
And I just think if I could go back to the start of 3rd year, there was a lot I would change, and just give myself a talk about what to do to make this year easier. And that's why I think I found exam season really hard, because I realised like, oh crap, there's a lot I need to know, and I don't know any of it. And I realised it's maybe like 6 weeks before exams, and that's why I had to go hard, like, to make sure I was prepared for these exams. And it was really hard on me. Maybe that's my fault, whatever, but that's why it's a 1. But guys, don't worry, for next year I know what I'm going to be doing. I'm going to rate it a 5 out of 5. There we go.
What was the best part of 3rd year for you?
Okay guys, I think the best part was basically because we're at the bottom of the food chain, we're the babies when it comes to clinical professionals or whatever, because we're in hospitals with doctors of like 20 years, these consultants that know everything. As soon as you say you're a 3rd year medical student, their expectations plummet to the floor.
They expect nothing from
and
you.
I loved it. I loved it. Like, as soon as a doctor spoke to you, like, hi, I'm a medical student. Oh, what year? 3rd year. They'll be like, oh, okay. Like, that understanding nod of, I expect nothing from this student. I loved it. I loved it.
Like, oh, you're 3rd year? You know nothing then. Yes, I know nothing. Please don't ask me questions.
You're only a baby. I am. Let me be a baby, because it just makes hospital placement less stressful, because obviously they still grill you, don't get me wrong, but they just grill you less than the 4th years and the 5th years
and the junior doctors
and the junior doctors. So
for me, the best part was just the exclusivity and just like the sick opportunity to be a medical student in the UK on placement, going into these staff only areas,
having a name badge,
getting access to really confidential information for your learning. Like, I was like, ooh, you know, I felt special. Like, it's actually really cool. Like, you get to see things other people don't. You get to see the behind the scenes of everything. Because they throw you into the deep end, you get to see everything. And I think it's a privilege to be able to be put in that position where you're kind of trusted with that information, or you're trusted with the safety of a patient, etc. So I
obviously
really like
observed and
obviously
all of
observed.
That stuff. I was in a surgery and they literally, it was a mastectomy where they removed a lady's right breast right in front of my eyes, and I was able to witness that. And then I've seen inside people's bodies in surgery.
I've seen inside someone's stomach. Like, it's so sick.
It's so cool. And finally, what are your expectations of 4th year?
From the bottom of my heart, I have none. I have 0. Because you know it is. I haven't done my market research yet. Before every academic year, I've got to do a bit of market research.
I've got to ask around.
I've got to you know, see what's out there, like what is actually expected for me in 4th year. Obviously we already know we have the dissertation in 4th year of like 8,000 words. Not looking forward to it. I do think it's going to finish
another
me.
essay, but this is like the essay of all
The
essays.
essay of all essays.
Guys, there will be a vlog of me crying about this essay.
Us
I'm not
crying.
manifesting it, but at this rate it's a trend. Like, I know
Yeah.
it's gonna happen.
Yeah, I kind of have zero expectations just because I haven't done my market research.
I am excited for 4th year because so 3rd year was more like the placements we were on were more like the basic human systems, body systems, so like the heart, the lungs, GI system, whatever. But now we're going to go into pediatrics, we're going to go into psychiatry.
True.
We're going to go into obs and gynae, which is like women health, and I just think we're going to go into the more specialist
areas of
medicine, which I'm excited for.
Fairs, yeah. But guys, that's all we have for our med school review. I love doing these reviews and just it's so cool to go back and just see how much we've developed, changed, and like, you know, developed our mindset and stuff. I really hope you guys enjoyed watching today's video.
If you guys want to see firsthand exactly what 3rd year was like for us, go check out our 3rd year medical school vlogs, and we'll see you in a new video next time. Bye.